This video is on the general physical examination of a patient, also known as the general survey. First thing you have to mention that I have examined the patient in a well-lit room after taking his or her consent with adequate privacy. That is very important to mention to the examiner. And then I like to divide it into 3 parts just to make it easy to remember. Otherwise, it's a long list of things that we have to note down and it becomes quite confusing. So I divide it into the consciousness, decubitus, facies, attitudes, skeletal deformities, height, weight, BMI, pallor, icterus, sinus, clubbing, all those features. And last one is the vitals, and we can add here skin and nails in the middle one, pallor, icterus, sinus 1. The first thing that we have to note down is that the patient is conscious, cooperative, and well oriented to time, place, and person. If you would like to add, you can add a GCS score, that is the Glasgow Coma scale. In a normal patient, it is 15 out of 15. Next, facies, attitude, and decubitus of the patient. Faces is the look of the face of the patient. Like some people can have moon-like faces, some have faces hypocritica, and or faces can be normal. And attitude, a patient can be agitated and anxious or calm, or just you can just say it's unremarkable. Decubitus of a person, if a person is healthy and active like me, then I can sit, I can lie down, I can roll on my bed, I can do whatever I want to. I have come for a injury on my hand, so I can stay in whatever position I like. So that means my decubitus is of choice. I can get into whatever position I want to. But then if my illness restricts my position, then let's say because of pain abdomen, I'm lying down flat on the bed, the patient is just lying down while he's talking to you, then that is a supine decubitus. His decubitus is supine. Or if the pain of the abdomen is so severe that the patient is rolled up and or bending forwards, then the patient's decubitus is sitting and stooping forward. And some patients with Golgi pain of the ureteric calculus, they will roll about, they will not be still. Patients of appendicitis and peritonitis, they will be still. And patients of acute pancreatitis will be stooped forward. So that is how this decubitus is important. And then we have to assess the height, weight, and BMI. Some examiners like height, weight, and BMI. Some like build, like average build or above average build. And that nutrition is poor, adequate, or nutrition is good. Skeletal and structural deformities. Now, some patients can have no hand, amputated limbs, or additional fingers like 6 fingers, polydactyly, or kyphosis and scoliosis and all that, and some sort of obvious deformity. Now, one point that we can add over here is performance score. This Karnofsky and ECOG score is mainly given for carcinoma patients. It just tells about how much of the day-to-day activity can this patient perform. Let's say a cancer patient, they become disabled, and maybe because of their weakness, because of the cancer, they are not able to perform the daily activities. So it's a score, the level of activity of the patient that he or she can afford to do. After all this comes the second part of the general physical examination, and that is checking the pallor, icterus, cyanosis, clubbing, koilonychia, lymphadenopathy, edema, and the hydration status. We can also take a look into the hair, skin, and nails. Engorged neck veins are present or absent, or any swelling in the neck is present or absent. All this pallor, icterus, sinus, clubbing. Let's say a mnemonic, it's called pickle, but according to me, it's pickled, PICCKLED. So it's pallor, icterus, cyanosis, clubbing, koilonychia, lymphadenopathy, edema, and dehydration. So when we present, if all these are absent, we have to say that pallor, icterus, cyanosis, clubbing, lymphadenopathy, edema, dehydration are absent. Now this lymphadenopathy is generalized lymphadenopathy. Edema is pedal edema. And hair, skin, and nails, sometimes skin can be very dry, skin can be very sweaty and moist. That's called cold and clammy skin. And hair can be absent. Patient can have alopecia, patient can have loss of all hair, eyebrows, nails can be very dry and brittle and cracked with longitudinal or transverse lines and pits. The last part will be the vitals of the patient, but we don't write vitals of the patient. We just directly write blood pressure, pulse. So the blood pressure is supposed to be measured in two limbs, right arm and left arm. So we have to mention that the blood pressure of the patient is 120 by 80 millimeters of mercury measured in the right arm, and it is 122 by 80 millimeters of mercury measured in the left arm. Or you could just say it is 120 by 80 millimeters of mercury on the right arm measured in the sitting position, and it is the same on the left arm. And you have to mention whether you took it in the sitting position or in the supine position. In your first exam, don't make a mistake of saying that the patient's decubitus is supine and then you're saying that I measured the BP in the sitting position. It sounds a little bit contradictory. Okay, now coming to pulse. Here the heading is not pulse rate, it's pulse, because in pulse you're going to see many things. That is the rate, the rhythm, the volume, character, any radial delay, radiofemoral delay, and peripheral pulses. Now, next is respiration. Respiration, you have to tell the respiratory rate and the type of respiration, that is abdominothoracic or thoraco-abdominal. And then comes the SpO2, that is measured in room air. Last but not the least is the temperature of the patient. Now, temperature can be measured in the mouth, in the axilla, in the rectum. For example, there are various body parts where you can measure the temperature. And for me right now, if you take a thermometer and put it in my mouth and or my axilla, the temperatures will slightly vary. Okay, so we have to mention where we measured it. So we can just say something like the temperature is 99.1 degree Fahrenheit measured in the right axilla. Thank you so much for watching this video. It was an absolute pleasure making this for you, and also thank you for subscribing to the channel.